My name is Dr. Cristin Mathew. I'm an orthopedic sports surgeon over at CHI St. Luke's Patient Medical Center. I did my training over at VCOM via College of Osteopathic Medicine at Virginia Tech, and later went on to do my residency at Northwell Health in New York City and Long Island Jewish. From there, I went on to do my fellowship at Houston Methodist in sports surgery, where I got to work with all the professional teams in the city. As a weekend warrior myself, because I continue to play rugby, I know the importance of being able to stay active and also be able to do the important things that you have to do during the week and getting to work. So a lot of my patients are weekend warriors, and it's great being able to take care of them because I understand the demands of their weekly needs, whether it's their house or their jobs, but also the demands of their sanity of being able to go out and play the sport or do the activities they absolutely love. One of the special techniques that I had the opportunity to train in is hip arthroscopy. There's not many of us that perform this surgery, and so hip arthroscopy provides us an option that we didn't have years before in being able to save hips. Oftentimes this revolves around fixing labral tears or even cartilage injuries, also fixing abnormal bony bumps that actually predispose people to hip arthritis. So it's a great way of saving people's hips and preventing them from having total hip replacements later in life. One of the great things about being an orthopedic surgeon is that you're able to help people get back to what they wanted to do. Their functional changes in life make a huge difference, and oftentimes people come back to you and say, I don't know why I waited so long to have this surgery. I love being able to see that change in patients so quickly. I don't have to necessarily wait for medications to kick in, but I know by structurally changing something, I've made them better, and I get them back to doing what they want to do a lot sooner.